Okay, so this is our population health community presentation. I'm Courtney, and then we have Tessa, Debbie, Emma, and Kirsten. And we're talking about the community of St. Paul, Oregon, which is just a few minutes away from Newburgh. So these are some pictures we captured from St. Paul, kind of giving you a little bit of a glimpse into what it looks like. It's a very small town. They're known for their rodeo, and they have a lot of children engaged in sports and horse related sports. But we specifically focused on the middle school and high school children within St. Paul. So for our introduction, it's a small community about 24 miles from Portland, Oregon, and we've assessed the middle school and high school population, and then specifically the mental health side of things. So there's about 455 people reported in their population statistics for St. Paul. And then this is kind of some statistics we gathered. One of the challenging things is getting statistics for the town versus statistics from the county. So some of these are a little bit mixed between town and county, but we found that there's about 480 households with about 3.02 children per family. And then 85% of the population is English speaking. Our median age of residents is about 34 years. And we have about 330 children from age 5 to 18. There's a poverty rate of only 5.21%. And then the city limits of St. Paul is less than 1 square mile, and the town is surrounded by lots of farmland. And then again, the rodeos, it's one of the largest rodeos in the US, so people come from all over to experience that during rodeo season. And then we noticed when we were driving through that there's a Catholic church and school as well as public schools. And then many of the surrounding farms are growing hops. And they also have a United States Postal Office location as well as City Hall. This is our population assessment. And we found that about 32% of adults graduated high school, 21% had some college education, and 26% had attained a bachelor's degree. The population there is mostly white with 95%, but the other, we found Asian and other races, or 2 or more races as the other makeup of the population, but mostly white people. And then 89% of the population speaks only English, and then while 10% speak Spanish and English.
So our windshield survey data, assessing the people, we found 2 main ethnic groups, Caucasian and Hispanic. Just looking at the people, they were wearing casual attire, jeans. Driving through town, we even saw some animals like horses, goats, and most of the people appeared to be middle or working class. Most people drove pickup trucks, cars. There was no public transportation noticed, and any politics things we saw, like probably mostly Republican. There's a couple Trump flags and a Spanish political sign. The town was incorporated in 1901, so a lot of the buildings are a lot older. Some even date to even over 100 years old. And the town is surrounded by geographical and agricultural areas. The town appears to be well maintained, clean, and there's overall a lot of town pride. Some major buildings that we found are the bank, school, church, a farm store, and the rodeo arena, as well as other people's homes. The common spaces we found were rodeo grounds, a coffee shop, diner, the school, church, and there's even a Saturday farmers market going on. The service centers there we found a cemetery, again, the church, post office, and bank. And there was also a fire department, school, and city hall. For Parks and Rec, we found a baseball field, playgrounds, and there's even a historic walking tour, again, the rodeo arena. The industries that we found there are mostly agriculture. There's an irrigation supply store, retail, restaurants, education, and lots of cosmetic places to get your hair cut. Overall, most people were either in school, at work, or working on their farms when we drove through. And this is some details for overall all of the Oregon students' health in 2020. These are some quotes that I pulled out. So it's interesting to see that more than 3 times as many 8th and 11th graders had unmet emotional or mental health care needs compared to physical health needs during the past 12 months. It's also interesting to see how many students experience emotional or mental health care needs that were not met. And it's interesting to see that these adolescents experience greater barriers to accessing that healthcare than younger children. And it's also a little bit surprising that if the students had a healthcare problem, physical or mental, they would most likely seek help from a counselor, but older students would not turn to anyone at school for help.
Unmute. We interviewed a couple people in the community just to gather some more information. And the first one was Tony Smith. He was the athletic director at the school and had previously been a principal at the high school for a while. And he said, generally speaking, they're healthy and active high school students participating in a lot of extracurricular sports, and that they have a physical education class like through a lot of grades, and they participate in fitness every day in middle school. And that they have a really high graduation rate, and like occasionally maybe one student won't graduate, but usually everyone graduates. And it's a small population at the school, but they're tight knit. And then we asked them how COVID impacted the schools, and of course, their health improved dramatically as they returned to school. Online was hard for students and teachers alike, just not motivated. Most of the students were, but when they came back, their grades improved a lot. And St. Paul newly hired a counselor, and they spent part of their time at the elementary school in St. Paul and then part of their time at the high school. But previously, St. Paul had contracted counselors from George Fox, so having a person there even half the time was an improvement. And then Tony also said that he guessed about 35% was a Hispanic population, and they were reluctant to access resources or come into the school to communicate their needs, especially the parents that were first-generation Americans. He said that they seemed to be reluctant to be involved with the community, but he hoped the community could do a better job including them and getting them involved, so there wasn't that gap. And then he talked about how they only have 1 bus route, and they used to have 2, but drivers are super hard to come by, so some children that board the bus have to ride it for much longer now since the bus has to cover more ground, and that they had to stop the bus service in the 1 mile square radius in the center of the town because of this inability to get more drivers. 75% of the students are engaged in sports. They have an FFA club, a successful choir program. They don't have a lot of other extracurriculars, but that's because all the students are doing these few things, and so the other clubs are hard to launch. But the small country town just has a lot of rural outdoor activities that people participate in, such as horse girls, hunters, fishermen, just a lot of outside activities. And then we asked him if kids go outside of the town to meet their needs a lot. And he said, yes, according to him, a lot of the residents make drives to St. Paul, to Newburgh or Woodburn, and he seemed to think that Newburgh was where most people went. We asked him about mental health and what he thought about that in the school. And he said, if you have eating disorders in the past, not prevalent and very hard for him to recognize, does not seem to be struggling right now when you looked at the current population. And he said health classes are offered a lot, and the school counselor has been a great new resource. And then our second person we interviewed was Tiffany, who was the school counselor, half-time at elementary school and half-time at the high school. And she said, just for the general health and COVID impact on the school, that they all seemed pretty good physically in tune with what they need, and that for mental health, most are doing really well. But of course, some are struggling with anxiety, stress, and depression. And some students don't seem to have very good relationships with teachers and friends. And some students had better success in virtual environments, but others not so much. She also said resources are available just short distances away, such as Newburgh, Salem, Kaiser, for the health disparities. And then most middle class and some lower income families, but there's free breakfast and lunch available to all students at the school. There's a more inclusive environment for all students. Most students, like 75 to 85%, are athletes, but then that leaves out the rest of the students. And new clubs for student voices to be heard. You know, she saw that as something to identify, because there's also no LGBTQ like plus club or a gay straight alliance group. For mental health, she said full-time school counselor resource with a mental health focus would be good. Student referrals are based on the county, so that's something that to consider. And then plans to share survey data with teachers and develop a plan to meet the needs. Staff and student committee she wanted to create, so it's better and more inclusive just for everybody to be on the same page. And continuing that, she reported one student with an eating disorder, and they have that discussion in their health class. And then for eating habits, she just said that teenagers want to eat whatever they like, but healthy options are provided for lunch and breakfast. There's a handful of kids above the healthy weight, so she talked about that. And she knows of 2 students who vape, but she estimates maybe 5 to 10 out of the 250 student population.
The first literature review that we found is titled Barriers and Facilitators to Mental Health Help Seeking for Young Elite Athletes, and this is a qualitative study. This study aims to determine what young elite athletes perceive as different barriers and facilitators to help seeking for their common mental health problems. And this looked at 15 athletes 16 to 23 years old, and they participated in one of 3 focus group discussions. Their data suggested that stigma was the most important perceived barrier to seeking help for young elite athletes. Also assessed their mental health literacy and negative past experience of help seeking. Facilitators to help seeking were encouragement from others, having an established relationship with a provider, pleasant previous interactions with providers, and the positive attitudes of others, like their coach, and access to the internet.
The second literature review was called A View from the Top, Superintendent's Perceptions of Mental Health Supports in Rural School Districts. So this was an exploratory study done to determine variables influencing California rural school districts in supporting their students' mental health. Models for addressing mental health needs in rural areas exist, but the decisions to implement these resources are made by district leaders with little to no background in mental health. Unique characteristics for rural schools include higher density of ethnic families, social stigma, skepticism about mental health services. The top barriers reporting to providing effective mental health support are physical resources, lack of mental health support staff, lack of community partners for continuing mental health services, and budget constraints. And some other notable barriers included lack of awareness of the need for the student population, personal beliefs and ideologies, and social stigmas. So in conclusion, education policy change has been initiated both federally and at the state level. This allows school districts increased flexibility in funding with the goal of overcoming barriers for mental health access in rural school districts. From there, we do our analysis of the data and identifying the community problem. So in terms of strength, weaknesses, and risk factors for St. Paul's, one of their big strengths is they have a counselor. There's a lot of rural school districts who don't even have this. And then many of their kids are active in sports and other extracurriculars. The weaknesses they have is the stigma around mental health. They still are a small town rural school, and the stigma is just something that is a big problem within the population. And then specifically for the Hispanic community, the reluctance to be involved, and the St. Paul community maybe not doing the best job reaching out, so they might feel isolated. And then risk factors when looking at the mental health focus, just the age of the high school and middle school students is a big thing. Adolescents are at risk for mental health issues, and then the fact that St. Paul is a small town and rural community. So the factors contributing to the mental health problems is that mental health is not promoted very well, just within the school and within the families because of the small town rural setting. A lot of the families, it's not talked about within the households, and there's maybe some unawareness by the adults of the students that are struggling with the mental health. And if these problems aren't solved, the number of students who are struggling with mental health who don't receive help or treatment will likely increase. So for our problem to focus on, it's mental health, the mental health of high and middle school students and the lack of awareness of it in St. Paul. And most of the Healthy People 2030 objectives around adolescents and mental health have to do with increasing the number of adolescents getting treatment. And then the adults need to be aware of the students' mental health in order for them to be able to have access to the help or treatment they need. So our population problem statement is mental health stigma is a problem we have identified within the community of St. Paul, Oregon. Throughout the community, there is lack of awareness of mental health as a significant issue among middle and high school students. So why we chose this problem? The first kind of reason we looked at was the Oregon Health Authority student survey, just the high percentage of students that reported that their mental health needs were not met and that there was kind of some stigma around that. Healthy People 2030 also had a lot of things around adolescents' mental health, just within recognizing it and getting them the appropriate treatment, which also indicated that for the adolescent population, mental health is something that needs to be focused on. Both of our key interviews noted that mental health is something that could be a problem within the population. Specifically, the counselor pointed out more of the issues that could be a problem in St. Paul and maybe even some ways that they could work on those. But then there was also a little bit of lack of awareness from some of the key interview. The coach especially just kind of pointed out eating disorders, but then didn't really know a lot else from that. And then our research articles both also kind of spoke of this. The first one having the information about the athletes and just the stigma and that they see around mental health, and the second one having the information about the rural school districts and just the challenges that they face in getting appropriate mental health services for their students.
Okay, so let's talk about planning, what we can do about this. Okay, so our goals and objectives. So the short-term SMART goal that we made was that middle and high school students in St. Paul will have increased access to mental health care resources and increased knowledge in overcoming mental health stigma by the end of the school year. We would like to increase the proportion of children and adolescents who get preventive mental health care in school. And then our long-term SMART goal is that St. Paul students will demonstrate increased utilization of mental health care resources, such as counseling sessions, a promotional bulletin board, or greater awareness in health and science courses over the next 4 years. And we would like to increase the proportion of children with mental health problems who get treatment. So some interventions for our short-term goal. The primary intervention that we could do is have the school counselor provide information to all grades twice a year about healthy ways to manage stress and anxiety. And then our secondary prevention is having anxiety and depression screening tools available for use by the school nurse or counselor if students are suspected of needing mental health resources. And then tertiary, we would like it for students to be able to be referred to mental health clinics or other resources if they are experiencing any mental health issues. So then some interventions for our long-term goal. Primary is we would like 2 to 8 hours of mental health education, including resources for attaining care, and reducing stigma to become a core education requirement for each school year at all the grade levels. And then secondary, we would like all students to be screened for mental health disorders yearly, and additionally transfer students to be screened 3 times throughout their first year, just because that's a pretty crucial time period when a student is new to a school. And then tertiary, we would like the school counselor to facilitate counseling that is available during school hours and even up till 5 p.m. for any students who desire it. And along with holding an open group counseling session weekly for any students who desire it as well. And then evaluation of those interventions that we are going to apply and the outcomes. So after conducting our key informant interviews and the research, we concluded that this problem needs to be addressed by reducing the stigma surrounding mental health disorders, and also working on increasing awareness and access to care for our St. Paul school population. From the research, it suggests that these interventions are especially critical for our selected population due to it being a pediatric population and an organ population. And so here are some statistics that kind of support those findings. According to the National Alliance of Mental Illness, in 2018, Oregon ranked last out of all 51 states for mental illness prevalence and access to care. And also, according to Mental Health America, in a 2020 survey, Oregon youth prevalence of mental health was ranked 47 out of 51, which indicates that our youth have a very high rate of mental illness. And then lastly, 50% of mental illness begins by age 14, and 75% develops by age 24. So just from these 3 statistics, we can really take away that our St. Paul school population is really at risk, being that they're in Oregon and also in that age group. So evaluating our interventions. From this, we implemented the following interventions. Kind of heard them already, but basically they centered around education to reduce stigma, health promotion initiatives to increase awareness, timely screenings for mental health disorders is especially important, and then lastly, just increasing access to treatment resources in their community. Excuse me. Ongoing evaluation of interventions. So we implemented these goals on a short-term and a long-term scope. And so we'd want to analyze whether the interventions were implemented. If so, were they successful? Did St. Paul actually make the changes in order to reach these goals, or is things just staying the same? And then we'd want to understand the effect of the interventions on the population. Are interventions working? Is there reduced stigma? Is there increased awareness? Are students getting better access to care, and so on? And so then lastly, just to wrap it all up, I would just like to remind everyone that we can break the stigma. We're all going to be future nurses very soon. And St. Paul is only about 15 minutes away from George Fox. And so each of us can just take it upon ourselves to reduce stigma, increase awareness, and provide mental health promotion initiatives to any clients that we interact with. So we'd like to just thank you all for listening to our presentation, and hope you have a good rest of your day. And here's our resources. Thanks, guys.